Hello everyone, welcome to Module 3 of Digital Health Foundation course for nurses. This module, we will be exploring about digital technology transformation in healthcare, how it is affecting patient quality care as well as nursing arena where we are including research, education and delivery of patient care. I'm Brigadier Punita Avnish Sharma, an alumnus of College of Nursing FMC. Presently, I'm employed as a technical director with Japaigo, India. I have around 40 years of educational and teaching experience in military nursing service in College of Nursing. And my encounter was with digital health when as a Brigadier Southwest Command, we have to educate our healthcare workers in all categories. I have developed a Disha platform, and from where we trained multiple times, multiple people into the COVID related activities, precaution, and preparedness. Topic covered during this module will be what is digital health, how this digital health has evolved in India, and then we will also say what are the different technology in digital health we are using, how it is important in nursing practice in bringing out quality patient care, and what are the benefit to the nurse, to the health system, and how it is shaping our policy work. What are our learning objectives, where we understand what are the digital health, how it is defined, the technology, key technology which we are using in the form of electronic medical records, telemedicine, or how it is improving our efficiency and patient care for nurses, as well as recognize how it is significant in delivering public health system in India. Digital Health for Nurses, Health Informatics, Module 3, Part 1. In this, we will dive into 3 parts. This module, Part 1, has covers the basic fundamentals, which is making a difference between the what is digitalization, and what is digital transformation. Part 2 will be dwelling upon introduction to health analytics, role of analytics in healthcare. Maybe we will go into the case study, and module 3 will be importance of digital health in a nursing profession, its processes, management, how a supply chain is getting affected. So let us explore what is digital health. Fundamental question. This technology has changed our daily life. Like everything is in our hand, palm top, and whether it is messaging, shopping, or health, like our life is becoming app based, health is no exception. It also going the similar transformation. Today, the list is very few. Now you can imagine a nurse has a faster access to patient record. She is able to communicate and coordinate with doctors. How it is improving. Imagine a patient comes to the trauma center and his vitals and his parameters history is available to everyone who makes a difference in his treatment resume. Now, we also would like to go in this slide, what is digital health? If you remember, you have seen in previous module how what is digital health and what are it is information of digital resources, how patient over telemedicine is getting his treatment, how it is improving the efficiency, transparency, and basic communication. Also, there are different few records, if we want to say, like there are HMIS, There are telemedicine, Sanjeevni, patient portal. You also have different AI-based solutions. You have certain point of care devices where on the spot we are able to see the patient um, data, his vitals, his status, and in the field itself, in the community health, like we say, we are able to seek consultation if it is required. It also helps in assessing our own performance and help in the various performance solutions. In next slide, we will be seeing what is digitalization, and digital transformation. First is digitization. It is a process of converting a handwritten patient record into a PDF. You must be aware in certain, even in certain hospital and small nursing homes, you go, you take doctor writes handwritten and the receptionist converts into PDF, scans it and keep it himself, which is available to them for their further reference, and hard copy is handed over to you. When we talk about digitalization, it is end-to-end electronic medical record where patient receives a number when it comes in the first contact with the facility, health facility, and then his complete journey is tracked from registration, treatment, investigation, and his billing. When we talk about digital transformation, it is a rethinking, redesigning of how healthcare delivery is integrated into different digital tools. It can be a patient comes to one hospital, but if required a consultation of super specialist, that is recorded. If he requires to take a specialist consultation, that is recorded. If it is required a nurse to consult central ICU, that also is possible. So digital transformation in actually has transformed patient care management, and it has also gave a very big advantage to the patient who are into hard to reach area, who are there in the villages and who are not able to commute to the hospital facility, and also benefited with minimizing out of pocket expenditure for them, for both healthcare facility as well as for the patient. Evolution of digital health in India. So let us, what do we understand about this timeline? How it has started? Whether it was in the handwritten prescription, which was so difficult at times to read. It was, you must be remembering, it is often said that doctor's handwriting can be read by a pharmacist or by himself. So the clarity was, this was leading to a lot of errors. But now a health system has come where the prescriptions are digitalized. It is available to everyone. But did you think what has triggered this to this transformation? Is it a public health crisis, or government of India has just implemented as a policy decision, or it is this use of smartphone in our day-to-day life? Let us think about it. When we talk about evolution of digital health in India, it is started way before COVID, but it took a big leap during COVID-19 pandemic. What was the requirement? Because in a very short period of span, we were supposed to reach to the larger number to the patient, to the policy maker, to the decision makers, and it was involving public and private sector both. So there was an urgent need to go into the digital health revolution in India. And then we were supposed to uh, deliver vaccine where there were patchy, where there was a isolation, there was lockdowns, and yet we were supposed to perform vaccination to save life of the individual patient, where the power of where they want to go and information which is the next nearest vaccination is available, which slot is suitable to them, real time tracking, as well as when the scarcity of vaccination was there, transparency was a big issue. So this resulted in adopting a COVID platform, and it has given the real-time monitoring to the government. E-Sanjeevani platform, which has come, is a further uh, patch the gap between specialist and to the consumer, that is patient and the doctor. The e-Sanjeevani platform has given power to the grassroots level worker to connect in time of need with the specialist at PSC or district hospital. ABDM is another platform where the person or individual gets registered, gets a unique ID, and then he can connect and know which all facilities are available. Same way, there is a Nikshay where you TB control management is taken, and all these platforms are interrelated. They work together and improve the access. Now we will see missions which has been taken by government of India. First and foremost is CoWIN. This is a platform which was developed during COVID-19 pandemic. It helps the real-time tracking, certification generation, booking appointment, and also how many doses, which type of vaccine people have taken. Second one is eSanjeevani, which is National Telemedicine Service. It allows doctor to consult patient remotely, especially rural and hard to reach area. And it also helps nurses to get patients ID, upload their investigation, upload their x-rays, so the diagnostic measures also can be taken and right treatment can be delivered. National Digital Health Mission introduces health IDs, electronic health records, and it allows patient data securely stored and shared when needed. This is also very important in making various policy decisions. And finally is ABDM, where the patient is given a unique ID and he is identified, and there is a unified digital health ecosystem. Next slide, we will dwelling upon in detail about each one of these digital tools or platforms. First, CoWIN. CoWIN is a success story of India's digital capabilities to the world. It stands for COVID Vaccine Intelligence Network. This digital platform was launched by Government of India to manage countries' COVID vaccination program. It used individuals were able to book slots, check their vaccination status, generate certificates and download them, and it was possible from their smartphones as well as in the computer. It was very, very user friendly, and it also gave, you can see the graph, which was here you can see the real type information was given to the individual who were logging in and wanted to know what type of performance or what type of vaccine is going on. So this built trust and transparency, And because of this was made as a global example of how digital mm, technology can transform the patient care delivery or any health system initiative. Next, we will look into e-Sanjeevani portal, which talks about India's national telemedicine service. This platform allows patient to consult doctor remotely without visiting hospital. This is our largest telemedicine initiative by Government of India. Here you can book appointment online, you can consult, and you also can choose your facility and doctor where you would like to go. And here the specialist to specialist consultation also is available. You can imagine a person sitting in the Siachen is able to get a appointment and consultation with the specialist in AIMS Delhi or Army Hospital RNR, which was a dream few years back because the super specialist concentration is there in the metro. So now this gap is really reduced. Here, the patient from a small village can connect with all medical college and super especially a hospital. It also supports various online OPD and tele diagnostic. National Digital Health Mission. It was built on the success of Aadhaar and UPI, which also has drawn its insight from the best practices from uh, world over, especially US and UK. And it was started in 2018, which was proposed as a strategy for digital health into the national health stack in the 2018 after concept to enable secure digital access to patient record through a centralized ID. In 2019, National Digital Health Mission blueprint was rolled out nationwide. And finally, in August 2020, the National Digital Health Mission was officially launched as a pilot. And the 1 year later, in the September 2021, it was rolled over pan-India. Since then, now it is converted into ABDM. Next is a very again Ayushman Bharat Digital Health Mission, ABDM, which is a refined version of Digital Health Mission of India, which has launched in August 2020 by Prime Minister Shri Narendra Modi ji, and it has got 7 sub-component. Ayushman Bharat Health accounts number for each individual who register on it. It also registers various healthcare professionals registration. It also connects different facilities and entire health system of India. And it also has a patient consent system where the power is there with the individual, and there is a unified health interference. And here the person is able to use this through a mobile app to access and manage all his reports, his prescription, his case sheet directly. And what we get as a nation, lot of data which is secure, and this can help us in giving input about utilization of public health facilities, type of illness which is occurring, what is the emerging scenario of healthcare disease pattern. So helps in defining and modifying or reintroducing or introducing new policies into the public health system. Let us recapitulate and have a quick pause to know how this Ayushman Bharat Digital Mission contributes to digital health. and let us explore in detail some of the key technology that powers it. Now we think upon how daily task of a nurse which she performs, whether she is posted in a hospital or she is there in the public health facility or uh, she is there in Arogya Mandir, which involves taking vital parameters, recording patient's information, or giving medicine. All this used to be there first in a written form, where now she does not have to write again. She just clicks and enters all this data into EMR system and tablet-based nursing chart or supports a teleconsultation for the patient. Key technologies in digital health, it's not a, just about one app or system. Know different technologies, they work together to improve how we deliver care. It has got a 6 major component: HMIS, electronic medical record, telemedicine, patient portal, app and wearable, and point of care devices. Here, the when we talk about each one of them in subsequent slide, we will see that how it has been made very effective, efficient, and time conserving uh, processes which are helping us to minimize error and improve our efficiency. First, we will see about hospital management information system. Here, it is a digital platform that supports hospital administrative, operational, and financial or billing activities. It also gets connected with pharmacy, laboratory management. What is the biggest advantage of HMIS? It is how it is streamlined functions, saving time, reducing paperwork, and helping multiple caregivers in one platform. Example, that Megha, a nurse in the emergency department, she is working there. All of a sudden, there is a trauma patient comes and she does not have to search where the case sheet is kept or whether it is, where is the pen, where is the pencil. She directly records this patient biodata, history, vitals in the electronic records. So immediately when she clicks it, it is available to the uh, person trauma specialist, to the lab, to the X-ray department, or maybe CT. So the generation of patient identity takes place and everybody is on the same platform to deliver effective, efficient, accurate patient care, and his management becomes better. Thus, the patient outcome also becomes good and it saves lot of time, lot of effort. Next, we will also see about electronic medical records. These medical records are also known as EMRs. These are the digital version of a patient paper chart. They help us capture, store, and access patient's data like history, vitals, medication, test result. This is one side. But at the same time, the nurse on duty don't have to search the complete case sheet to record that page, which is by mistake has gone into the mid of the complete big bundle of her medical charting papers. And it is available to her instantly where she is able to make draw comparison, make conclusions, and this gives us a power to make a quicker decision and helps in which is also at times connected with the certain tools which helps us in best practice care pathways which is available for the patient in that organization, and also helps in a give quick glance to the drug interaction which patient is receiving. So resultant, it is not only benefited to the patient, it also benefited to the healthcare provider, because now she is empowered to take right clinical decision. She also knows what drug interaction can take place and how she can prevent that. She also can consult with the related app what is the best decision she should take out of all decision available for that patient. What is so individualized care can be given to the individual. We now look upon the telemedicine, a game changer in the digital health area. Especially, I have told this before also, where the limited access is available, the specialists are very few, and that too concentrated in a metros or the big hospitals or to the medical college. Now imagine the nurse CHO, which is there at the Ayushman Arogya Mandir, Health and Wellness Center in the urban areas. Here, this becomes a point of contact with the specialist referral, follow-ups, prescription support, health education, and emergency trials. It also helps to the patient's home where the person is able to give patient about real-time care when patient is not able to come to the hospital. This is India's national e-Sanjeevani portal, which also gives a empowerment to the ANMs to use this specialist. And imagine the satisfaction level which this CHO will be drawing by uploading, consulting with the super specialist directly. There is no in-between channel. So there's a very, very powerful technology which is used in India in the form of e-Sanjeev. Next, we will look upon what are the available for the patient portal. What is patient portal? This is a secure digital platform that allows patient to access and manage their health record on their own. It brings about transparency, and it also makes them charge of their own health journey. A very good example of this is Abha app, which is part of India's ABDM system. Here, patient can using their health ID, view their prescription, result, test result, and consult specialist. This also help patient to seek specific health advice. A nurse who is helping a patient, maybe Kamla, in a chronic condition, which does not require day-to-day individual to visit the Arogya Mandir. She is on her home visit, and or maybe attending in VHND, where she views patients' reports. She also tell them to set alarm to take medication, to how to update their health data, and track their own blood sugar or BP, which is a very important part in their uh, controlling and managing their own illness. So this digitalization or digital technology has empowered even a patient in a remote area to take control of his own condition and be part in management of our own disease. Another gadget which is begun uh, transforming healthcare delivery, especially in the chronic disease cases as well as the mother and neonatal or child health space, where with different type of apps and wearable. Now, these have become very common, whether it is in one watch or it is there in the smartphone. It is these are the tool like fitness tracker, how many step, healthy you, which is diet management, or other devices. Now, what happens where this patient are able to monitor their daily routine, daily goals, and they are able to make their informed lifestyle decision. For nurse, how it is important. Here we are able to teach patient how to use a particular device, how to monitor their vital, how to stay active, how to bring about dietary control, dietary modification, and also plan their follow-up visit. This also can use some data about the trend into the healthcare, and this also individualized patient. You are able to detect any abnormality early and take a appropriate action, so when it gets benefited to the patient. Point of care testing devices, these are devices which is used by healthcare worker into allowing faster diagnostic, improve patient outcome, and they are used at the patient bedside. It includes recording BP, recording blood sugar. It also says about the identification of high-risk pregnancies, giving appropriate care. It also very important and useful technology in a critical care areas or in emergency and disaster. I would like to quote an example here. Hemant, a nurse in a high dependency unit, uses a blood sugar monitor to check blood sugar of a patient who is having a uncontrolled diabetic and going into the hypoglycemia. Now, it gives a life-saving decision making for the patient, and also we are able to give and adjust maybe the medication, maybe insulin accordingly. Imagine you are a nurse and you are working in a healthcare center where many patients struggle to access specialist care due to long travel distance and limited resources. To address this issue, government is exploring digital health solution to make healthcare more accessible. I would like to ask you, which digital health application would you like to use to improve healthcare access in the rural population? Let us just list down and recapitulate. With this, we have completed our module 3, part 1, wherein we have learned about what is digital health, what is basics of digital health, what it is meaning, how it is evolved, and the technologies which are we using in the India, and how it is uh, transforming our healthcare journey. There are few digital health uh, platforms like CoWIN, eSanjeevani, ABDM, which has helped India's health journey. In next coming up part 2 of 3 module, we will be looking about benefit of digital health in public health, introduction to health analytics, and importance of digital health in nursing practice. Thank you, audience, for connecting with us. Now we will be moving to the next portion of our slide, and I really appreciate you all for connecting with us and being partner in this educative information about digital health and empowering self, because knowledge is very powerful tool. Next slide, we will be looking for what is the benefit of digital health to India, how it is as a nursing professional, which is helping us.